Today's patio chat is being brought to you locally by Westridge Furniture in Delphus. See it all at your finer outdoor furniture store.
Well, Mercy Health St. Rita's has been expanding its technology and treatments for us right here at home. We're going to learn more about two of those advancements. To my immediate left, we have, of course, Dr. Matt Owens. He's the Chief Clinical Officer at Mercy Health St. Rita's. So thanks for coming today.
Sure, Ollie. Glad to be here.
Okay, so I'm sure you guys are always looking out for like the newest and latest things, but you've got a couple that you want to highlight. Two new advancements that you've been using lately in Lima.
Yeah, two new things that this summer we're rolling out to make sure that we're continuing to advance what we can do at St. Rita's to take care of our community, because our goal has always been to create an environment in which our patients can be taken care of here and not necessarily have to travel outside. The first one is the Ion robot. We're really excited about this. You know, more and more procedures are being done using a robot these days. It creates less invasive surgery, and it also creates a quicker recovery time for patients. This new robot is actually used to go in and get very small pieces of little growths in the lungs called nodules. And what we're hoping is that we can detect lung cancers much, much, much earlier than we used to, therefore allowing patients a much better quality of life and much more likelihood of remission.
Will you even be able to get a little bit of that, or was it major surgery to get those nodules to check them out before?
Well, in the past, frankly, you would just monitor them and see if they were growing.
Oh, really?
And now we can get to pieces that are as small as a centimeter. This is kind of like a GPS device for the lungs, so it helps us get to the exact place we need to. And again, the robots are incredible. They allow the surgeons or the proceduralist hands to get right into that little nodule and get a piece of what they need.
That is really cool. That is very neat. Yeah, because lung cancer, I mean, we're talking about generations of people smoking, and, you know, we're starting to stop smoking, but people don't realize sometimes that they might even have issues with their lungs.
Lung cancer remains one of the leading causes of death in the country, and part of that is because we never had a great way to diagnose it really early. This technology hopefully allows us to diagnose it much earlier, and therefore, again, give people earlier diagnosis, earlier treatment, and hopefully that leads to better outcomes.
Certainly, yeah. Okay, so tell us about the other then advancement that you have.
Yeah. The TriClip. So the TriClip device just builds on what we can already do with heart care at St. Rita's. This is the first of its kind. The heart is a beautifully made organ. I mean, it really is amazing to watch it. And there are valves within the heart that help the flow of blood go in the right direction. Sometimes those valves can get leaky. And so what's continually being developed, and this one is for the tricuspid valve, is a device that helps to prevent that leakiness. If something leaks, we can fix the leak so that people can have a much better quality of life and really have longevity. This device won't be for everybody, but it will particularly be for some of those who can't tolerate open heart surgery because they're not safe enough to do that big surgery, and this might give them really great quality of life for many, many years once they go through this.
Okay, so instead of like that valve replacement, this is you're helping with the leaks? What is it, like caulk or something? What are you doing in there?
We go in through a blood vessel, so there's no big incision or anything. We go in through a blood vessel, we go into the heart, we actually put a clip around the valve so that it stops leaking but still lets blood go through safely. And it's just medical technology is advancing so quickly, and I'm just blessed enough to be at the center of it so I can watch it happen.
Right, yeah, that really seems like that'd be something for sure. Both of these, that you'd be sending people out of town, and as you mentioned at the beginning, you don't have to. You can stay home, and I assume recovery's better too when people are at home and with their family, what they know comfortable with. This
is the goal. I mean, St. Rita's has always prided itself on bringing new technologies into the community so that people can stay here. It's great to have visitors if you are in the hospital. Many times with some of these, well, with both of these procedures, many times you'll just go straight home. So it reduces the amount of time people are in the hospital. It helps you be around family and familiarity, and you're not traveling to a big city to get it done.
Plus, I think it's good for people to hear about these treatments so they're maybe not afraid to even tell their doctor about it, so that you can get these things done, right?
Just ask your doctor. I mean, if your doctor thinks you're a candidate for any of this type of stuff, or if you've been watching one of those really small lung nodules, for example, with the Ion device, it would be nothing more than talking to your doctor and getting a referral to our pulmonology department or getting a referral to our cardiologist to get checked out and see if you're a candidate.
All right. Awesome stuff. Thanks for sharing today.
Yes, thank you for having me.
All right, don't go away. We'll take a look at the weather forecast next.